States that have legalized medical cannabis usually have provisions for children to be treated. Now, while it's legal, is it safe? Does it work? Do kids get high from it? Well, let's talk about that. Hey everybody, it's Dr. David. I'm a board certified pediatrician in Tampa. I am also a cannabis certifying physician. From what I've been told, I have certified more children in the state of Florida than anybody else. And this is something that's been a passion of mine and that I've learned a lot about. Now, I also do certify adults, and a lot of adults like to be treated like their pediatrician when they were growing up, so that kind of works out really well. In addition to that, I also, as Dr. David MD, that's the name of my consultation practice, I also do consultations to help educate people, even to help them choose certain types of products, etc. If they're outside the state of Florida, but they're still looking for an expert to help guide them through the process, and I can help them do make recommendations to them as to how they may be able to treat themselves, even if they're on it already, and to be able to treat their children. Now, we're going to talk today about kids and cannabis. We're going to talk about the legalities, the safety of it. We're going to talk about the effectiveness, but also the concerns about using something like THC with cannabis. Now, in terms of kids and medical cannabis itself, as I said before, most states do have some type of provision allowing for medical marijuana to be used by children. Okay. Now, of course, there is going to be different criteria from one state to the other. Some may allow for inhalation versus some may not. Say may only allow for CBD. Some may allow for THC, etc. But one of the things that was a concern is that once cannabis became legal in America, first from medical, but also from recreational, that this would serve as a way to show kids that it's okay to use it. And there was a lot of concern about an increase in the use of cannabis in children. Okay. In fact, that's absolutely not what happened. There is a survey. It's called the Youth Risk Behavior Survey Data Summary and Trends Report. And this is from 2011 to 2021. So we don't have data for the last couple of years. But they were one of the things that they looked at is the percentage of high schoolers who were reporting the use of cannabis, and specifically over the previous 30 days when they would ask. The interesting thing is that back in 2011, 23% of high schoolers specifically said, yeah, they used cannabis in the last 30 days. But fast forward 10 years later, 2021, that number dropped to 16%. So that's like almost a 1/3 drop in the number of kids who are using cannabis, at least regular enough to be in the last month. And that's really indicating to us that despite the concerns about all the legalization of cannabis, that the trend seems to be going down, not up. So obviously that's a good thing. I know that's things a lot of people were concerned about. But so far that the data has shown the opposite to happen. And so very good to know that. Now, in terms of the legality of pediatric medical cannabis, it does really depend on the state. I didn't go through all of the states, state by state, but from everything I told, there's some type of provisions there, but what they're allowed to get. Okay. Now, for all of the states, though, one thing is in common. No person under the age of 18, or in some states 21, can go and get it on their own. They have to have a caregiver. Usually it's a parent, some other family member to do it, but the caregiver has to get a card, has to be approved in some manner as the one who goes to buy it for them, the one who's obviously going to transport it with them, and the one who's legally allowed to give it, to administer the cannabis. So a kid's not supposed to do any of those things. A kid's not supposed to have access to the product themselves. They're supposed to be giving it to them. They're not supposed to store it on them. They're certainly not supposed to be traveling with it, driving in their cars with it as adolescents, etc. Certainly not to be able to just go into school and take any of it. Now, most states also do not allow for smoking of actually getting the flower. In Florida here, there is an exemption that if it's a terminally ill patient that they will allow for that. But every state is different. I didn't even attempt to look that one up because it was hard to find, and it's just way too much variability there. Now, some states, including the state of Florida, do allow the flower, the buds themselves, to be ground up and put into almost like a little K-cup that is like a tamper-proof that can be put into a vaporizer. And the kind of like that you pop the little capsule, the little capsule cup in, and then you push it on, and then it would create a vapor, like when people do dry herb vaporization. So the main advantage of that for those states that allow it is that you get a full plant medicine. No processing whatsoever to make a tincture or to make a vaporized oil or something like that. It's the pure thing, and that's what a lot of people really want, is the whole plant medicine. Okay, the synergy within all of the ingredients within it. The nice thing about when a person is doing that way is it can also affect the different temperatures, because these dry or vaporizers will allow you to set the temperature higher or lower, which can affect how much that's actually combusted, versus when it's low enough, it's not supposed to be combusted at all. It's supposed to convection heat causes the release of the cannabinoids and the terpenes. Now, all of the states that allow for medical cannabis for children do allow for oral use. Gummies are usually allowed. Certainly capsules and tinctures would be allowed. Now, when for those states though, and I know it was really important here in the state of Florida, but I think all states do have it, that if they're going to have that type of product available, to not have child attracting label, like attractive labels, like something that would draw the eye to a kid, that they would get it because it had a cartoon on it, or it had a color on it, or it had some other design that would be attracting their eye, that they would maybe want to go take it. Another thing that most states did is they prohibited the dispensaries for medical cannabis to have candies themselves that are like shaped like candies. So in Florida, for instance, you can't make it look like a gummy. You can't make it look like some other character. It's either going to be a square or a circle. They also don't put food coloring in it, which, thank God, that was really cool that they, at least in Florida, that they said don't put food colorings, because food colorings attract children. I'm like, yay, no reason to put something into a medically fragile child who's needing medical cannabis. No reason to put food colorings into their product as well. So that was really nice. I always did wonder why they put food coloring in Benadryl, especially when people were having allergic reactions and having negative reactions. Why you take the Benadryl, so you're going to put some other artificial substance into there. That kind of didn't make sense, but I'm off the subject there a little bit, but you kind of get the point. Now, as of 2022, 11 states did allow for use at school. Okay. Now, for some of them, the parent would be allowed to go into the school and be the administrator. Okay. Here in Florida, because a child can only have 2 caregivers, and you can't be a caregiver to a number of people, that means like a nurse would not be allowed to do that, because they'd have to have like a caregiver card for every single student who would be getting it. But there are other states that do allow for a nurse, like the school nurse, to administer it. So you do have to check between state to state on that. But, if a kid is needing it to stay calm at school, to stay focused at school, to stop having seizures at school or whatever, it clearly would be something that would be beneficial for them, so that they don't that their level doesn't drop within their bloodstream, that could start bringing back symptoms. Okay. Now, in terms of, do kids get high from it? Yeah, of course they can get high from it. Of course, it's a dose-dependent thing. Like a 1 or 2 milligrams is not going to get somebody high. 10 or 20 or more will get somebody high. Same thing, like a sip of wine versus a bottle of wine would have a different effect on people. But cannabis can be used in a way that doesn't get a child intoxicated. A big part of that, though, is the co-administration of THC. Of course, that's the chemical that does cause the intoxication, the inebriation, whatever term that you want to use. But CBD lowers or blocks that potential. So, part of what I do is I always say bring the CBD in first and then bring the THC in, but keep the CBD going, bringing in the THC at a slower, gradual rate, and until we get the effect, whether it's positive or negative. Now, if increasing the THC content would make a kid get high, increase the CBD and then try it again and see what happens. Okay. Of course, you may find out that, I don't need to take that much CBD, and I can lower it a little bit, and I'm still doing well. The kid's not getting intoxicated. Oh, now it is, and I better bring it back up. So titrating the doses, making one change at a time, which is something, of course, I've always strongly encouraged people to do. That is the best way to make sure that a kid doesn't get high. One of the interesting observations that I've made, though, is kids with autism, especially severe, they don't, even with higher doses, even without CBD, a lot of them do not get high. And I think it's because kids with autism have been shown to have lower levels of the natural endocannabinoids that we all make, we have our receptors that get stimulated by. And kids on the spectrum seem to have lower levels. So maybe it's more of like a replacement therapy for them, as opposed to a cup run thing over type of thing. But I don't know how I'm going to prove that. Okay. Now, question, of course, is it safe? Now, of course, CBD, in fact, all of the C's, the CBV, the CBDs, the CBGs, the CBGAs, the CBNs that I've talked about on this channel, and I'll be talking more about, they're not intoxicating. I really have low concern whatsoever in terms of their safety or long-term potential effects. It's THC that I do have a concern about. Brains are developing even up to 22, 25 years of age. And we know that there is an impact of THC on developing brains, and why it's also really important to use as small of an amount of THC if it's needed in the first place. Okay, really important. We don't want to be doing it because, again, there does seem to be a lot of information that it can impact overall long-term development. Okay, and of course, some of my autistic children with autism, and I realize that their development is already impaired. But for some of the other conditions, like people who are using it for cancer, or people who are using it for PTSD children, using it for those purposes, we want to make sure that it's not impacting their brain in a negative way. So it's always a really good idea to use as little THC as possible in order to get the optimal effects. Now, you often you'll see at dispensaries that they do also have ratio products, okay, and like a 1-to-1 ratio, or a 1-to-5 ratio, or 5-to-1 ratio. The first number is always the amount of CBD. The second number is always the amount of THC. And again, some of these ratioed products can also have a very good effect in terms of stopping the intoxication of the THC. I typically recommend not using those products to start off with, though, because if you're trying to figure out the amount of the ratio, maybe it turns out that a 7-to-3 ratio is the ideal amount. And you can accomplish that if there's two different products, a tincture that has, or a gummy for that matter, that has CBD and has THC, another one has THC. But if it's pre-mixed in a ratio, you can't increase one without increasing the other because it's a premix. So, but at the end of the day, if it turns out that a 1-to-1 is what the ratio is for that kid, or 5-to-1, and it's out there, then of course, by all means, we can use it because that's just one product instead of two needing to be given. Now, in terms of the effectiveness, okay, I have found it to be one of the more effective treatments for a lot of different conditions in my medical cannabis, my pediatric patients. In my kids with autism, improving the irritability, the violent behaviors, especially that's seen during the second decade of life and the hormones have kicked in. There's very few options. There's some medications that are pretty harsh, things like Risperdal and some of the SSRIs, Abilify, etc. But I have much more success with these products than I do with those other ones for those types of symptoms. In terms of stopping seizures, to be very effective for that. Of course, most often that is with CBD, but I do have some patients who their seizures being stopped happen due to the THC. So, but of course, we try the CBD first anyway. Anxiety and panic. Overall anxiety. Some kids just have anxiety all the time. Some people go into panic attacks. When it comes to inhaling it, and I didn't talk much about the vaporizing and vape oils, but of course that's a way of inhaling it, as well as there are ways, like in some states, and we here in Florida, having a meter dose inhaler like an asthma puffer. But for kids, as well as for adults for that matter, having the inhaled version is almost instant in terms of the effects. You could turn somebody's symptoms off within 3 to 5 minutes, which is amazing. I don't know of really any other medication that can do it that fast. Now, also in terms of sleep, especially some of the indica types of products that are out there, but also CBN would be phenomenal for sleep for kids. And of course, there's many others as well. Now, what about the negative effects? Now, as I said, there is concern about the long-term use and the earlier the earlier use, the younger use, the more concerning it would be. But some kids will get tired from it. Some kids will eat a lot. I have seen kids put a lot of weight on from it, and that can be an issue as well. Some kids can just kind of seem like a little aloof or withdrawn from it, even though they may be happy, but they can be like laissez-faire about things, and we don't want to see that. Some kids I've seen get giddy and silly, and to me, that's not always a bad thing. If a kid's a little happier and finds more humor in things, or likes to get laugh, it's one thing. If they're, of course, laughing all day in classroom and not accomplishing anything more than that, then that's obviously not cool. We need to make a change. And of course, the lung effects, especially if it's being inhaled. Now, fortunately, because terpenes are used instead of artificial flavors, and at dispensaries, there's not the vitamin E that was being used to cut the THC, the cannabis oils on the street, which is what were causing the lung damage. Thankfully, that's not an issue when people get it from a legal medical dispensary. And of course, if they are allowed to smoke, and of course, this is a problem more for street since medically they couldn't get it, but of course, smoking is smoking, and if you're burning something into your lungs, that's bad. Nobody should burn anything into their lungs, whether it's cannabis, whether it's tobacco, whether it's banana leaves, cloves, or anything, or a fire in your house, God forbid, or in the neighborhood, or why people have problems when there's like these wildfires that are out there. Putting smoke into your lungs is not good for you. All right, so overall, what's my take? Very effective. I'm so glad that I have the opportunity to help my patients with this incredible herbal medicine. We do need a lot to learn a lot more, and a lot more research is going to be done. And it's very soon that there will be the completion of the changing of the schedule of the Controlled Substance Act, and once that goes from a 1 down to 3, we'll be able to see a lot more research being done about that. But it's also important to work with a provider who knows what they're doing, who can guide you through this, who can make changes on the fly. So again, kind of as another plug, if anybody does need any help trying to figure out what the optimal protocol could be for somebody, I can certainly make those types of recommendations if you reach out. Anyways, there you go. Now you may know something more about pediatric use of medical cannabis. Have a great day.